right, we are right at noon. Good afternoon, everyone, and welcome to our virtual Q&A session on weight loss. We're so glad you could join us. Before we begin, a few housekeeping notes. All participants' cameras and microphones have been turned off to ensure a smooth experience. Our providers will be answering general health-related questions for educational purposes only. They are unable to diagnose or provide specific medical advice regarding unique healthcare concerns. For personalized medical care, we encourage you to consult directly with a healthcare provider. Today's session is being recorded, and a link to the video will be sent to your email in the coming days. We've received an incredible number of questions. Thank you to everyone who submitted them. Our expert panelists will do their best to cover as many as possible during our time together today. If we don't get to your question today, don't worry. We'll be working on answering them in future posts on our blog at trinityhealthmichigan.org. Today, we'll be covering a range of weight loss topics, including bariatric surgery, diabetes management, GLP-1 medications, the HMR Weight Management program, and the lifestyle medicine program and nutrition. Now, I'd like to get started by introducing our expert panelists. Let's start with Dr. Zenny.
Okay, thanks for allowing me to participate in this. I'm excited to be with you all here today. Dr. Talal Zenny. I've been Director of Minimally Invasive Bariatric Surgery at Trinity IHA Bariatric Surgery since 2005, so 20 years. And we've been a center of excellence since 2008. We have a comprehensive program that includes dietitians, psychologists, nurse practitioners, coordinators, all to ensure that we support our patients so that they can have the best outcomes. Thank you.
Thank you. Let's move on to Dr. Brake.
Hi, so I'm Dr. Bob Brakey. I've been a family physician in Ann Arbor area now and on staff at Trinity for 39 years with special interest in trying to help get to the root cause of illness. And I'm head of our IHA Lifestyle Medicine, William J. Folletti Lifestyle Medicine Division. Pleasure to be here, and thanks for inviting me.
Thank you. Dr. Berman.
Good afternoon. Thank you for inviting us. I am an internal medicine doctor in this area, and I've been with the system since 2001. I'm a medical director of a weight loss program that's called HMR Weight Loss Program here with St. Joe's for the past, I would say, 15 years. This program is celebrating 40th anniversary, and for 35 years out of those 40, it's been collaborating for St. Joe's system. So very happy to be here. Thank you.
Thank you. Lisa McDowell.
Hi, everybody. I'm Lisa McDowell, and I am the Director for Preventive Nutrition and Wellness at Trinity Health Ann Arbor. And I'm very proud to be board certified in lifestyle medicine as well as a registered dietitian. I've been with Trinity over 30 years, and I'm part of a team that provides many ambulatory programs that help support a healthy lifestyle and prevent, treat, and reverse disease with developing great habits. So nice to be here.
Thank you. Lisa Somack.
Oh, and that's Lois, but you're fine. Yeah, my name is Lois, and I am a registered dietitian also, and also a certified diabetes educator. So I am with the Department of Community Health and Well-Being, and under that is indeed diabetes care and nutrition. The other part of our department is the diabetes prevention program.
Thank you. Thank you all for your wonderful introductions. We will now transition into our Q&A session. All right, starting off with bariatric surgery. What are the different types of bariatric surgery?
Thanks very much for that question. So there are three main types of bariatric surgery that I'd like to talk you about today. Sleeve gastrectomy, gastric bypass, and SADE, or otherwise known as single anastomosis duodenal ileostomy. So sleeve gastrectomy is still the most commonly performed surgery. It's where you remove about 80% of the intestine, 80% of the stomach, I'm sorry, and leaving about 20% of the stomach. You don't bypass any intestine with this surgery. And there are also some digestive hormone changes that allow a patient to feel less hunger, like for instance in the GLP-1, ghrelin, PYY. And so those also help to lose weight. Gastric bypass, you make a stomach pouch that's about an ounce in size, and then you bypass like 25% of the intestine. And then the third surgery is the SADE, which you do a sleeve first, and then you bypass about half of the intestine. And so each one of these surgeries is going to have varying degrees of weight loss and also varying degrees of benefits and downsides to them. We will evaluate each patient and recommend in order which we think is going to be best for their weight loss and for resolving their other medical diseases.
All right, question number 2. How much weight can I realistically expect to lose after bariatric surgery?
So depending on the surgery that you do, we can see varying degrees of weight loss. But in general, a person can expect to lose about 70% of their excess weight on average, or about 25 to 33% of their total body weight. So for instance, if somebody weighs 300 pounds, on average, they can lose on average about 100 pounds. Some people lose only 40%, which would be roughly of their excess weight, which would roughly be about 60 pounds. Some people lose the full amount and lose the full 150 pounds, let's say, if their ideal weight is 150 pounds. The sleeve is going to have that kind of weight loss. The bypass will be a little bit more, about 10 pounds more, and then the SADE will be, for instance, another 10 pounds. Obviously, it varies from patient to patient. Exercising is very important after surgery, sticking to the diet, focusing on protein, healthy diet with fruits and vegetables is very important in order to really realize the best weight loss outcomes.
Question number 3. Can bariatric surgery help with comorbid conditions like diabetes or sleep apnea?
So one of the great things about bariatric surgery is not only does it help with losing weight, but it also helps these medical diseases or comorbidities like diabetes, high blood pressure, sleep apnea. So overall, I would say diabetes is resolved, goes away in about 85% of patients. It varies from surgery to surgery, but even patients that are on insulin, about 40% will be able to come off their insulin. And if they don't come off insulin, usually they're able to decrease their insulin dosage by about 65 to 75%. High blood pressure, about a third of the time it goes away, a third it's improved, with less medication being needed, and a third of the time people just have high blood pressure that's essential and doesn't go away. Sleep apnea is resolved in about 60% of patients where they're able to stop and not need their CPAP machine any longer.
Number 4, what are the risks and benefits of GLP-1 drugs compared to bariatric surgery?
So as I briefly mentioned before, one of the very interesting things about bariatric surgery is it also increases the GLP-1 digestive hormone. Obviously, GLP-1 drugs are out there today, Wegovy or Ozempic and Zepbound or Mounjaro. They are very effective for losing weight. On average, people can lose about 16 to 21% of their total body weight. So again, we come back to the example of somebody who's 300 pounds. For instance, on average, they would lose somewhere between 48 to 63 pounds. Now, it's less weight loss than you would realize with surgery, but it's still very good weight loss. GLP-1 drugs, though, need to be taken, long term. Once a person stops them, unfortunately, we see people gaining weight back. There are only preliminary studies out there, but one study that I read recently suggests that, about half people come off the medication at a year, and then about 75% at 2 years. And really, people do need to continue taking them to realize the benefit, just like they would need to continue taking them for diabetes to lower their blood sugar. Otherwise, their blood sugar will rise. The side effects are, nausea, vomiting, GI discomfort, some pancreatitis. Obviously, a person with a thyroid cancer history cannot take them, but they are effective. And again, bariatric surgery remains more effective, but they can both be used in the treatment of weight loss to great effect.
Thank you. Number 5, why might gastric bypass be recommended over gastric sleeve surgery?
So every person is different. Typical reasons I would recommend gastric bypass over sleeve are if a patient BMI is more than 54 or more than in the 50s, they need to lose more weight. And so you need something more than just the restriction afforded by the sleeve surgery. So that roughly corresponds to a person who is 150 pounds above their ideal weight or more. Also, patients that, and those patients would also be candidates for a SADE surgery that we talked about earlier. Another reason is if somebody has severe reflux that's not controlled with medications, I would definitely recommend the gastric bypass in those situations because it's more effective in resolving or improving the reflux and heartburn. A third reason is if somebody's diabetic, particularly if they're on insulin, gastric bypass SADE are going to be more effective than the sleeve in resolving that.
All right, thank you. After major weight loss, how can I get rid of loose skin?
So we want a person to wait about 1.5 years after surgery. That way they realize the weight loss from the surgery and plateau typically, although some people can lose weight after 1.5 years. And there's various surgeries, obviously, tummy tuck, arms, breasts, and usually I do perform tummy tucks, but also, the patients can see plastic surgeons and go about, performing surgery for those.
Thank you, Dr. Zenny. We're now going to transition on to our next topic, GLP-1 medications with Dr. Brakey. Question number 1, what are the criteria to qualify for GLP-1 medications?
All right, thank you. Let's actually step back a step and define this for people who don't know. GLP-1 stands for glucagon-like peptide 1 medications, which are hormones formed mostly in the intestines in response to food that then go back to the brain and suppress appetite. They're also actually formed in the brainstem in response to input from the vagus nerve that senses what's going on in the gut and says, hey, we've eaten, we're good, we can slow down appetite. The real ones within our bodies degrade very quickly, so you can't just give GLP-1 to people. It only lasts a few minutes in the bloodstream. But they discovered in the saliva of a Gila monster a certain GLP agonist, which plugs into the same GLP receptors and can have the similar effect in the brain to suppress appetite, decrease stomach emptying time, and therefore help people to lose weight and better manage diabetes. With that, I infer from this question, looking at how do we get the expense of these, they're very expensive medications, covered by insurance, and different insurances are different. Some have a preferred one for, Wegovy or Zepbound or other GLP-1s, and you really have to kind of check with your insurance. In general, the indications are for people with obesity and diabetes. This is where some of the best criteria, where they seem to work best and have the improved outcomes. And many are aware that Blue Cross and BCN in our area, as of January 1st, don't cover most GLP-1s for weight loss anymore, citing concerns about safety and efficacy. And we'll come back to those as we get to next step questions.
Thank you. Besides weight loss, what are other benefits of taking GLP-1 meds?
Well, because obesity is so much of a concern for health concerns, if a person can lose weight on GLP-1, and in some manner, it's a big if, they can also then reduce their risk for type 2 diabetes, lower cholesterol, decrease risk for several cancers, including breast cancer, decrease risk for sleep apnea. And so again, this question kind of infers that besides weight loss, and some people do get excellent results, but these meds are actually quite overrated. If you take 1,000 people and have them on GLP-1, as Dr. Zenny mentioned, a majority do not stick with it beyond just a few months because of significant side effects. And we'll come to those next. But with respect to outcomes for weight loss, it plateaus after a year at about 15 to 20% of weight loss. And only 1 out of 25 people who take these meds actually get down to normal weight, starting from obesity. On average, in the drug company studies, patients started out obese, and after a year on the meds, were still obese. So again, this question kind of defines or says these meds are going to cause weight loss, but actually more people gain weight on these meds, even after a year of taking them, than get down to normal weight on these meds. So again, a little bit of kind of balancing the question here. Appreciate that. And again, benefits for those ones that can do it. After a year, about a third of people do maintain at least a 10% weight loss. And those tend to be the ones you hear about, but the other 2/3 have either significant side effects or they don't work.
All right. Are GLP-1 medications a lifelong commitment?
Well, again, another kind of trick question, as Dr. Zenny mentioned, if you stop taking them, the weight comes back. Part of the other challenge with the weight loss from these meds is only about 60% of it is from fat weight. 40% on average is lean body weight loss, that is muscle and bone loss. And part of the problem is that you may lose 15% of body weight. And again, that could be 30 to 40 pounds. But after you stop it, you gain 2/3 of that back. And most of that is the fat weight. So you end up worse off than you were. You're taking a med which loses weight, 40% of which is lean body weight. And if you stop taking it, you regain. So in my practice, what I tell people is definitely not. You don't want to be on a medicine that's expensive, doesn't work very well, risks side effects for long term. You should think of this as a short-term jumpstart if you're even going to consider it at all.
Okay. Using GLP-1 to reduce weight would help cholesterol levels, but do the benefits outweigh the risk?
Well, let's say it can help cholesterol levels. So a lot of people do have a drop in cholesterol, but because it pulls cholesterol out from the fat that's stored in there, that can often crystallize and increase the risk of gallstones. So great question. And this is a big part of the challenge. I put down some numbers. Again, if you put 1,000 people studied over 3 years of GLP-1, 375 of those 1,000 have a 10% weight loss benefit maintained. 221 have nausea, 118 constipation, 110 vomiting, 100 diarrhea, 84 upset stomach, 57 weight loss, 43 upper abdominal pain, 41 lower abdominal pain, 22 dizziness, 13 headaches, 8 gallstones, and 4 cases of pancreatitis. So again, you can see that although the marketing show the benefits and the great results that some people have, most people either don't tolerate these meds or can have quite serious side effects, including hemorrhagic pancreatitis. The pancreas is very active in its GLP-1 receptors. And in one study, they looked at people who had died from various causes and had been on these meds for at least a year, and 100% of them had swollen, inflamed areas of the pancreas, some of which knew tumors. And I think Dr. Zenny mentioned that anybody with a history of thyroid cancer should not take these meds because there's a 50% increased risk of thyroid cancer by taking these meds. And pancreatic cancer is a maybe. They did show that in laboratory animals. We don't know yet for humans, but the whole field of weight loss medicines over the years is replete with multiple examples of these meds causing significant harms, including the fen-phen debacle, where tens of thousands of people were injured from heart valve problems. And it remained on the market for decades before they could do this. So these meds have only been out for 4 years, and that's one of the challenges is we have no long-term safety data. When we look at introducing a med, we look first, is it safe? We don't know. What are the long-term effects? Is it going to increase pancreatic cancer? It definitely increases pancreatitis and multiple side effects. Next is tolerance, the side effects I mentioned. Next is the efficacy. It only works for a minority, and then it plateaus after a year. And if you stop it, it comes right back again. So it's not really addressing the root cause. The next is price. At over $1,300 a month, or about $15,000 a year retail. Now, a lot of people get their insurance coverage, but remember, we all pay that. If everybody eligible, 135 million Americans, were put on these GLP-1s, our healthcare spend would increase by about $2 trillion. In context, it's only 4.5 trillion now, and the entire drug spend is only 700 billion. So we would quadruple our drug spend just from these meds if they were used for everybody. And we all pay that. Everybody's concerned about inflation now. It's not that my insurance covered it. That gets passed on in the form of cost of automobiles and toothpaste and other. So if people, we're fortunate that many of the companies are not covering it now because that leads to decreased demand for these meds, which don't have a good either a benefit or risk profile. And then finally is convenience. Most of these are injected. They do have an oral form, which looks like it's working about as well as the regular, but that's many of the risks are still being uncovered, and we won't know for a while how safe these are.
Okay, have GLP-1 meds been proven to work on perimenopause-related weight gain?
This hormone-related weight gain is very common, and they can work as well on that as they can on other weight gain, which, as I mentioned, is not real good if you look at everybody in aggregate. But there's no reason to think it would be any worse with respect to perimenopausal weight gain. The real issue there is a hormone imbalance from fiber-deficient diet, because the liver takes excess estrogen and puts it out into the bile, and it can send it out if there's enough fiber in the diet. The average American only eats 15 grams a day, and I'm sure Lois and Lisa are going to cover this a bit. But that leads to that recirculation and a lot of challenge with perimenopausal hot flashes and weight gain. So the real issue there is and can be managed with lifestyle approaches, including improved diet. Rather than GLP-1s, which are, again, that's just a Band-Aid.
Thank you, Dr. Brakey. We're going to move on to our next topic, HMR Weight Management Program. First question, what's the best way to lose weight quickly but healthily?
Wonderful question. And I have to say, though, I, with great interest, was listening to my colleagues, Dr. Zenny and Dr. Brakey. I love to learn, and when I talk to my patients about weight loss, I really would like to offer everything that's available. In many ways, I compare weight loss or obesity treatment as a treatment of, let's say, back pain, right? So there's a lot of treatment from ibuprofen, physical therapy, and at the end of the road, sometimes we need a surgery as well, right? So the same could be said about other chronic illnesses, including diabetes, including obesity. And that's really why you have all of us here today on the screen, because we represent all of those corners that could together help people to lose weight. Another statement is that it's really difficult for us as medical providers not to personalize an advice because we're so used to just really take the patient one at a time and evaluate everything that the patient needs as a person, as a patient, and then offer them the best advice possible. Today, we're just sort of giving you general answers to general questions. Please take it as such. So if at some point you want to know more about your particular condition, you'll have to talk to us in person so we can really target your health and give you the most benefits. In terms of best way to lose weight quickly, so there is a sort of an idea in public that losing weight quickly is unhealthy and bounces back. I would say that based on CDC recommendations, and many nutrition specialists will agree with that, losing about 2+ pounds a week is quite safe and sustainable, health-wise and also emotionally as well. And that's what we do in HMR. I would say that at the very beginning, the first week, if patients stick to the process, we can see up to 5 to 6 pound weight loss the first week or two. And after that, it slows down to 2.5 pounds a week. And that continues for as long as the patient is staying in an active program. So it is a safe way to do it. Now, we have a medical staff, including nurses, PAs, nurse practitioners, and physicians, who assure that the weight loss is safe through the lab work if it is necessary, and weekly checks and checking the blood pressure, et cetera, et cetera.
Thank you. Question number 2, how can I stay motivated and successful in my weight loss journey?
Excellent question. All of us are asking this question sometimes of ourselves. I would say that willpower is a very short-lived tool, so we really cannot rely on that. And in our opinion, support system helps to achieve the best results. So HMR offers weekly virtual or in-person classes. So patient leaves the class with tips, advice, prescription for food, prescription for movement, strategies, answers to their most important questions. So in every week we repeat this. So we walk the walk with our patients. And in my opinion, this is the tool for success.
Thank you. Is there a program that includes a weight loss medication and low-calorie meals like frozen meals and shakes?
So HMR is not that kind of a program. So HMR does not prescribe weight loss medications, but we do medically supervise and follow the patients who come to us on those medications. Some of them will transition out of those medications during the process of weight loss with HMR, and some patients might choose to stay on them. But all of those patients come on medications that's already prescribed by their primary care providers. In terms of frozen meals, so our meals are not frozen. Our meals are prepared with the vacuum sealed packages, so they're shelf stable. There is no need to freeze them. There is no need to keep them in any particular temperature. So that's why I'm saying we're not that. So we do provide meals, but they're not frozen. So they're actually quite convenient because you can keep them in a hot weather in your car or in a cold weather in your trunk, or it can be in on your shelf in your office. And when you're hungry, you just can pull it out and warm it up in the microwave. That's it.
Number 4, I struggle with portion control. How can I convince myself that smaller portions are enough?
Yes, it's difficult. You know, HMR was initially designed by a clinical psychologist who recognized 40 years ago, that relationship with food is something to work on. Relationship could be positive or it could be toxic and negative. So we really focus on restructuring our relationship with food and learning different lifestyle methods and strategies. So in our one-to-one support classes, we teach our patients how to face the struggle open-mindedly and how to walk this difficult walk We always support, we answer questions. We're only one phone call away if it's necessary. So it's just a constant support. You don't have to convince yourself that the small portion is necessary. You will get to that realization as you're changing your lifestyle.
Thank you. Now, you already answered, I believe, the first part of this question, but how quickly can I expect to see results with the HMR program, and how sustainable are the weight loss results?
So we have in HMR, we have a concept of prescription, and we call it staying in a box. And it just a term that all of our participants are familiar with. And what it truly means is accountability, lifestyle change, movement, and eating prescription diet. So if people do that, and majority of do with our support, then you could easily lose, as I mentioned, 2.5+ pounds every week. HMR does utilize meal replacement as an additional tool, but what's important in HMR plan is a lifestyle modification. So our hope is that at the end of the journey with HMR, people learn to live and relate to food differently. So sustainability comes from new skills and not from food that we're providing. And so far, it is a sustainable result. We have a lot of statistics behind it. Many of our patients continue to lose weight or be very stable. We also offer support for years and years after we're done with HMR active plan itself. So we have phase 2, we have phase 3. Many of our patients choose to come to us for many years. We have participants who have been with the program for 15 to 20 years, and they come monthly just to refresh their relationship with food again, to stay on track, and to bring the questions that needs to be answered.
Thank you so much, Dr. Berman. We're going to move on to diabetes management with Lois Somack. Question 1, can type 2 diabetes be reversed, or can a person become no longer dependent on medication?
So type 2 diabetes, the word is remissions, not reversal. So what is remission? Remission of type 2 diabetes would include a normal blood sugar for 3 whole months, and also with it same time frame, no medication needed to maintain those normal blood sugar levels. So certainly, yes, a person can go from medication into not taking medication as time goes by.
Okay. Can weight loss help prevent the progression from pre-diabetes to type 2 diabetes?
Certainly. So, looking at weight loss, sometimes people are discouraged because they think, oh my gosh, I have 50 pounds to lose. But no, wait a minute. Research has shown that a 5 to 7% weight loss can greatly improve, for example, fasting blood sugar and hemoglobin A1C. So, yes, and weight loss is just part of it, though. So weight loss can help prevent the progression of from prediabetes to type 2 diabetes, yes, but there's other factors too, which are, of course, healthy diet, exercise, and medication if needed.
Thank you. Number 3, if I decide to go on Ozempic, could it potentially replace my daily metformin for type 2 diabetes?
So this is such an individual question. So I'm not going to attempt to go into much detail about this, but if I see a person, a patient, for example, we would maybe discuss some of this, and then I would go ahead and defer that decision to their physician, encourage them to discuss it with their physician.
Thank you. Number 4, can I participate in the diabetes education program if I am pre-diabetic?
Sure. So officially our title is Diabetes Care and Nutrition. So yes, we do see people with type 1 and type 2 diabetes, but we also see patients, people that just need medical nutrition therapy, in other words, nutrition counseling. So there's 2 registered dietitians on our staff, and certainly that we do that as well.
Okay. I am diabetic, stable at the moment, but keep gaining and losing the same 3 pounds. I do strength training at the gym and walk 4 to 5 miles. Any advice?
So this is a great question. Whoever asked this question, I commend you for exercising, being so focused and consistent with exercise. The importance of exercise simply cannot be overrated. Exercise is important, so important for our well-being, our functionality, and all of us humans as time goes by. What happens if we don't exercise? We lose lean muscle mass. Our tendons, our joints, ligaments become less supple, where we lose our flexibility. So, having said that, exercise is just one component of weight loss. So, there's other things too. So, I would say diet and focusing on diet, especially, in just taking a look at what you're eating, and especially calories. Calories do matter. So for this person, I would say just go ahead a little bit further and focus on diet, and probably log your intake just to help you be a bit more accountable and aware of what you're eating.
Number 6, what is the connection between diabetes, stress, and weight gain?
So with diabetes, sometimes we just look at the numbers and blood sugar and think, well, blood sugar is high because maybe I'm eating the wrong things or too much of the right things. And certainly food is a source of our blood sugar increasing. Our blood sugar is supposed to go up when we eat. Stress can also be a factor. So what stress does is increase we're humans, we all have stress, and that increases cortisone in our body, and it causes blood sugar to go up. So I would say in regard to stress, since we know we're all going to have stress, just examine what are some strategies and simple strategies we can do to cope with stress. And it's going to be different for everyone. Everyone's de-stressors are a little bit different. Simple things, activities you enjoy. Oh my gosh, if exercise is a de-stressor for you, that is really the best because you get all these other benefits from exercise. Other de-stressors, simple things like even humor, watching TV, even pets, reaching out to a friend that you can vent to. Some kind of hobby, especially things that you're working with our hands, can be de-stressing, soothing activities.
Thank you. And last question, your diabetes education program helped me adjust my medication or insulin routine based on my diet and activity level.
Again, I would defer to the physician I'm not a physician, so I can't prescribe, I can't, change medications. Certainly I can make suggestions to physicians regarding all these things. So yeah, that would be something to discuss, certainly.
Thank you so much, Lois. We're going to move on to our lifestyle medicine. Question 1, I eat a healthy diet and stay active, but I still can't lose weight. Why?
Well, first of all, you are not alone. US statistics, we haven't really talked about those, but over 74% of adults are overweight or obese. Over 40% of our children are overweight or obese, and 54% of adults have type 2 diabetes or prediabetes. These numbers are just staggering. And we know that the prevalence is a result of our supply chain for food. Over 70% of calories consumed in the US are from processed and ultra-processed foods that are devoid of all of the good nutrients that our bodies need and crave. So when we are selecting these ultra-processed foods, we tend to overeat on calories because we're looking for the nutrients. So it's really difficult to navigate our way to success. And this is part of the reason that we started our lifestyle medicine program, so that we can look at the whole picture of how we can help people have some control over their choices, their daily rituals. And we know that it's bigger than just our food choices. So lifestyle medicine is an evidence-based subspecialty that treats people with the 6 different pillars of lifestyle medicine. And that includes a daily movement, exercise, a plant-forward dietary pattern, restorative sleep, positive social connections, healthy stress management, and then avoiding risky substances. And you may think alcohol and tobacco, but also things like too much screen time, too much Netflix or social media. And so really looking at the whole day and having people think about it. I think we're victims of habit, and we get into a routine where we're not often very thoughtful about what our choices are. And sometimes we find ourselves ill prepared with not having the resources needed to get through the day, thus resulting in eating out more because we didn't plan ahead.
Thank you. Number 2, what are the best strategies for losing weight after menopause? I want to become vegetarian. What are my best options for a balanced diet?
Okay, so I think, again, many of the strategies are similar for everybody. After menopause, we do know that as we age, we lose lean body mass. And so committing to a strength training program that really establishes good muscle structure is very important. Muscle directly impacts our metabolic rate. So the more muscle we have, the more generous our calorie intake might be. Starting a vegetarian diet is I think so simple these days. There are just so many choices, but I think it's really key to read labels to become a superfood hunter. Not all foods are created equal, and it's important to take time to read labels to try to avoid any products that have artificial colors and sweeteners and fillers, and just look for a whole food, plant predominant diet without all of the added ingredients. And to go slow as we increase fiber, as Dr. Brakey mentioned, the average American intake, I've read anywhere from 11 to 15 grams a day. And the recommendations being, closer to 25, 30 grams of fiber, if not more, per day. And that really protects us. So looking at strategies for how to build a healthy plate where we have contributions from healthy carbohydrate, whole grains, high fiber, a lot of color, and good protein and healthy fats on our plate.
Number 3, how can I lose weight naturally without medication? I've already cut sugar and reduced portions.
So again, I would suggest looking at all of the facets of life. And sometimes you could have the best caloric intake, the best choices, but maybe you're somebody who is working the night shift or is only getting 5.5 hours of sleep. We know research shows us that insufficient sleep can lead to increased cravings from our hormones, specifically cortisol, which can make us crave simple carbohydrates, upwards of 200 to 500 extra calories per day. So this is something that is difficult to fight against. So looking at opportunities to improve sleep patterns in the way that you're socially connected can make a difference, how much you're moving throughout the day. Many of us have office jobs where we may be seated for 6, 8, 10 hours straight, maybe lots of meetings on the calendar. And we like to look at opportunities for exercise snacks or exercise breaks, where even if you were to do just 10 body squats on the hour, or going for a walk on the hour, just getting little simple extra movement in throughout the day can help burn calories. Dr. Berman also suggested keeping a journal, looking at what we're consuming. I think that's very helpful to understand just how much Americans, we tend to underestimate how much we eat. I've worked with a lot of food records, and when you go in and ask some deeper questions, a lot of times we underestimate how much sleep we're getting. We overestimate how much sleep we're getting and underestimate how many calories we're eating.
Number 4, how can I get enough protein on a plant-based diet while keeping calories in check?
Again, I think the whole protein issue has been overstated, overblown, and it really is not difficult to get sufficient protein. We know that most plants have protein in them. And so when you pair that with things like lentils and beans, it is very simple to get enough protein.
How can the lifestyle medicine program help me achieve long-term weight loss and better health?
This is where I think we start to develop deeper habit formation. We encourage our patients to keep a list of their non-negotiables and where they set their standards. So, for example, many may choose no longer to drink alcohol or to stop eating after 7 p.m. and really look at the establishing kind of your firm daily repetitive patterns. Of course, there are situations that would result in deviation from that list, but generally speaking, that list of non-negotiables becomes, I think, your manifest for life. You're going to move every day. You're going to try to get 8 hours of sleep every night. You're going to get 5 different colors of fruits and vegetables per day. We encourage getting over 40 different plant compounds in a week in our diet. So maybe keeping a list at the table and writing down to see if you can get to 40 different plant foods. I think it's just really being still with yourself and looking at your own rituals. You know, what does your day comprise of, and where are there opportunities to move more, to connect more, to form relationships, have walking partners where you can take a quick 5-minute, 10-minute walk with at work. These small habits add up and make profound change. And it's never too late to start, and it's just beginning with your process. Everybody is coming at it from a different place. What we have most in common is our supply chain for food being so incredibly complicated and difficult because of the ultra processed food everywhere. And this is where having some extra help in terms of cooking could help. We offer free culinary classes every month that we encourage everybody to sign up for and join us.
After age 60, how does one lose weight with diet? I could always lose before I hit that milestone.
So I think this results again from the loss of lean body mass as we get older, and it doesn't have to be that way. We just have to be committed to frequent movement and to building some resistance training in our day so that we can maintain our lean body mass, which equates to a higher basal metabolic rate.
Thank you, Lisa. We are going to move on. We have a couple of minutes left, so we're just going to let all of our panelists go through and give us some key takeaways from today's presentation. Dr. Zenny?
Yeah, this has been a great panel to outline various ways of losing weight, and each of these has a role to play in weight loss. And I think one key message across all 5 of us was that it's important with weight loss to maintain your muscle mass, and getting in the necessary protein is critical. And, strength training, resistance training is very important to maintain your muscle mass, because if you lose weight and you lose muscle mass, and your resting metabolic rate decreases, then it's going to be harder to lose weight in the future. Bariatric surgery is very effective, And for those patients that are ready for that, we have a comprehensive center here at Trinity Health that really works with patients to optimize their outcomes. And thank you again.
Thank you. Dr. Berman.
Hey, well, I'm very grateful for all of my colleagues today. It's really very comprehensive review of what could be done about chronic illness that's called obesity. In nowadays, in age, life is so fast, and food is the smallest part of what we pay attention at, and it probably should be, as Lisa said, because it's our nutrition and that's what sustains us. We just don't have time for this, and very often that's a major obstacle to weight loss. It's hard to do and hard to stay consistent. So the HMR offers to offset this problem. So we try to do it fast. We try to do it portion controlled, low calorie, fewer decisions, variety of foods. But overall, we're learning how to live life a different way and healthier. So that's what HMR offers. And thank you for giving us time to talk about it.
Thank you, Dr. Berman. Dr. Brakey.
So the obesity epidemic is not some failure of willpower. Over millions of years, we have evolved in a time of scarcity when humans lived in near starvation, and we got rewards, including dopamine rewards, for finding foods that were high in calorie density, sugar, and salt. And originally, these were fruits and potatoes and foods that sustained us. And now you plop a human with that kind of brain and that kind of physiology down in an environment that Lisa described, filled with ultra-processed foods, with foods that are very calorie dense and very nutrient poor. And the obesity epidemic is a natural consequence of that. So we want to get away from sort of that individual shame and blame and start to focus on how can we as a society make it better and easier for people. And a part of it is education. Is recognizing that, as we've discussed here, we all have the power to choose what we take. And by choosing foods that are high in nutrient value, including phytonutrients, dietary fiber, great quality proteins and antioxidants that are rich in all of these plant foods that are behind me here, by limiting foods like the animal foods that have no fiber or phytonutrients. And a lot of people think of chicken as a weight loss food. Very poor. They have obesified chickens, and they're now 60% fat from the calories. The protein in there and high as methionine and also triggers inflammation and food cravings. So cut back on all animal foods and processed foods. Eat healthy, whole food, plant-based foods, and you will find that you lose weight without counting calories, portions, without worrying about protein, calcium, or probiotics. Eat real food, and you'll be able to lose weight. Exercise certainly helps for that, but as one person mentioned in the Q&A, it alone will not help you lose weight. It can help you maintain once you get there, but you really need to focus on the nutrient side to help lose weight. I'll also post a series of videos by Dr. Greger on the GLP-1s for my section. He really does a good job of going over the benefits, the risks, the challenges, the concerns, the costs that go into that. Also, I'll send out what I call my 8 keys handout that I give to all of my patients with an overview of all of the different components of lifestyle medicine. As Lisa mentioned, they're all important. And then also a series of references. Look up a book called How Not to Die by Dr. Greger, where he catalogs how you can prevent our most common diseases, including obesity, diabetes, hypertension, strokes, and heart attacks. And then his second book, How Not to Diet, especially pertinent to our discussion today. Either one comes on audiobook or other, and he will help to build from the ground up an evidence-based approach without conflict of interest, not trying to sell you anything, approach to maintain your health and well-being for the long run. Thank you.
Thank you so much, Dr. Brakey. Lisa McDowell.
I concur with Dr. Brakey's suggestions, and I think another consideration is similar to what the airlines instruct, to put your own oxygen mask on first. They say man without disease wishes for many things, but once you have disease, you only wish for one thing, and that is your health back. And we have the control over what happens by the choices that we make. And I believe that if we develop our list of those non-negotiables and structure our rituals and routines, that we're really optimizing our health span where we can push disease to the very end of that last marginal decade until we die. And I think being dependent on medications for health is really challenging. So when we look at reversing, treating, and preventing disease with lifestyle, I think those messages are so important. And I think they don't get as much advertisement, if you will, because there's not a lot to sell when it comes with good sleep, right? Or move more. There's not profit by industry to be gained there. And so I'm really recommending everybody check out our free classes. We have an introduction to lifestyle medicine that's free monthly, and then our virtual cooking with plants classes. Thank you.
Thank you so much, Lisa. And Lois.
So many of the participants again are here today are interested in either weight loss or improvement in blood sugar results, or maybe both. And again, strategies for all of that. And I always say 4 things. Diet. What about diet? So what the other participants said, certainly high fiber, plant-based diets, including some lean protein, eating throughout the day, probably not skipping meals, some healthy fats, and especially an abundance of non-starchy vegetables. All good. Exercise. How much exercise? Minimum of exercise would be 30 minutes a day. Cardio 5 days a week. Strength training is important as well. Can you go beyond that? Oh, certainly. Third thing is, if you are prescribed medications, be compliant with those medications. And the fourth thing is some gradual weight loss. So those 4 things are a very powerful combination in achieving your goals. In addition, I just wanted to just bring your attention to our program again, and a flyer from Diabetes Care and Nutrition will be shared to all participants, and how to initiate any contact with us. Thank you.
Thank you so much, Lois. And thank you all for joining us today for our Q&A on weight loss. You all will be receiving a follow-up email in the coming days, including a recording of this event, including the resources all of our expert panelists mentioned. Thank you everyone for joining, and have a great rest of your day.
Thank you. Stay well, everyone.